There you go.
There it is. Great.
Does look like, one second, it looks like our Medicare guru actually is able to join us. So let me just send her the link.
Someone said there's a big echo.
All right.
We have complaints.
Yours for now. Because we
Uh,
don't.
Okay. So again, welcome everybody. I am going to mute this PC because we're getting someone is describing an echo. So glad to have you, Andrea. And here we go.
All right. Thank you so much for having me. We're excited to come out to you folks virtually in Western Mass. What I put together today is a semi-short presentation. We're going to go through the different plan offerings here at Harvard Pilgrim, some of the benefits, some of the different things that we do here. But really, what I wanted to do was leave the bulk of the time for questions, because I'm sure that you have them and nobody wants to hear me drone on for, 50 slides. So I would hoping that this can be more of an interactive meeting, here for you here, to make sure that you have the information that you need as you start to contemplate annual enrollment for this year. So as folks, I'm sure are aware, annual enrollment for the GIC starts tomorrow. It goes through May 1st, so you've got just about a month to pick your plan, and you do have to pick a plan. So the GIC, I believe, is going to be sending out information, I want to say tomorrow, on how to enroll, how to register for their GIC link. Their GIC link is how you enroll in your benefits online. Not sure if there is a paper process for your different municipalities, but registering for my GIC link and going online is definitely the best way to go. It's going to be the easiest. So I'm going to talk about, I'm going to start off with our commercial plans. So the commercial plans for active and non-Medicare enrollees. So you could be a retiree, and for whatever reason you've been paying into a pension, a whole host of reasons, you are not eligible for Medicare, so you would remain on a commercial plan as a retiree. So those are the plans we're going to talk about right now. And the first one that we offer is Harvard Pilgrim Explorer POS. So this plan is for enrollees who live in New England. When we talk about enrollees, we are talking about the subscriber. So you need to live in Connecticut, Massachusetts, Maine, New Hampshire, Rhode Island, or Vermont to be eligible for this plan. This is a three-tiered plan. You have access to the entire Harvard Pilgrim provider network. So we would call this a broad network plan. Any provider in the Harvard network, any facility would be fine for you to go to. For this plan, your highest level of coverage would be the in-network level of coverage, and that kicks in when you select a PCP, and that PCP refers you to specialists. You also have the option outside of New England of utilizing the United network. So United is what allows us to offer nationwide coverage. So if you were outside of New England and you needed care, you go to a United provider, and that claim processes at the in-network level of benefits. Now, say you're in New England, you want to see a provider who is not part of the Harvard Pilgrim network, or you don't want to list a PCP, you don't want to ask for referrals, you want to essentially self-direct your care, you do have that option. Those claims would pay at the lower level of coverage. You would be responsible for a deductible and a 20% coinsurance. So you have that flexibility, so you can almost treat this plan like a PPO if you wanted to. So if you're in network, the claims are going to process at the tiered level of benefits. So you have three tiers. Tier one is going to be your least expensive tier. So PCPs would be $10 for copay, specialists the 30, hospitals $275. And for hospital, that is inpatient. That's an inpatient copayment. PCPs, middle of the road, tier two, $20. Specialists take $60 copay. Hospital inpatient is $500. And then tier 3 is going to be your highest amount of cost sharing in network. So PCP copays are 40, specialists are 75, and hospital copay is $1,500. Across the board for these plans, for all the plans I'm going to talk about commercially today, you are capped at 4 inpatient copayments a year. So once per quarter or 4 a year. So hopefully, no one is impatient enough to hit that cap, but it does offer you, a level of protection. If you have a year where you're having a particularly tough time, you're only going to be responsible for that inpatient copayment 4 times total. This plan does have a deductible. It has an in-network deductible and an out-of-network deductible. The in-network deductible for individuals, and same for out-of-network, is $500, and then for families, it's $1,000. You also have an out-of-pocket maximum. So in network, it's $5,000 per member, out of network, $5,000. And then for families, it's $10,000 in and out of network. For people who may not be really super familiar with what an out-of-pocket maximum is, the out-of-pocket maximum is the most amount of money you pay out of your pocket, not including premiums, in a given plan year. So all the money that you pay at the doctor's office, so your co-payments, your deductible, any co-insurances that you pay, prescription drugs that you pick up at the pharmacy or have mailed to you, all of that money that you pay towards over the course of the year goes towards your out-of-pocket maximum. If you're an individual, once you have paid out $5,000 in a given year, you don't have any more cost share in and out of network. So again, it's just sort of a level of protection. We would again hope that you're not having a year where you're shelling out a whole bunch of money because your health necessitates it. But in the event you do, you have some protection. Really quickly, this slide just gives you a snapshot of the hospitals and where they fall as far as the tiering goes. So you can see that most hospitals, the bulk of the hospitals are falling in tier 1. That's the longest list. Middle of the road, tier 2, still really, really great coverage at that less expensive level of cost share. And then tier 3, which again is the highest level of cost share. You've got, just a handful of hospitals. This is where you're going to see the Mass General system fall. So Brigham and Women's, Mass General, Newton Wellesley, that is the tier that they fall into. You're also going to find the Cape and the Islands, the hospitals out there also fall into this higher tier. The next plan we're going to talk about is quality HMO. For this plan, enrollees need to live in mainland Massachusetts. So if you live on the Cape, you live in the islands, you are not eligible for this plan. This plan is 2 tiers. It's a limited network plan. So what that means is there are some providers who are part of the Harvard Pilgrim network who are not in the network for this plan. The most prominent exclusion are the providers and hospitals that are associated with Mass General. There are a handful of others. Again, so the Cape and the Islands, those providers and hospitals would not be part of this network. So you still have very good coverage. There is still a very robust provider and hospital network here. You only have in-network coverage. You don't have an out-of-network benefit for this plan. You don't have the option of going out of network. The only exception, obviously, and of course, is if you had a medical emergency, you needed emergency care. And then if you happen to be traveling outside of Massachusetts and you needed to go to urgent care, that would be covered as well. If you are in Massachusetts and you need urgent care, you would need to see a contracted urgent care provider, of which there are tons and tons and tons. I think that there's an urgent care provider now on every corner, and sometimes there's 2 on a corner. This plan, only 2 tiers, so you're going to have lower co-payments. Tier 1, the specialist $30, hospitals $275. Again, that is for inpatient. Specialist is going to be $60, and hospitals inpatient is $50. The nice thing about this plan is that the PCPs are not tiered. So regardless of whether your PCP is tier 1 or tier 2, it's only going to be a $20 copayment. This plan does have a deductible. It's a little bit of a lower deductible. So for individuals, it's $400. And for families, it's $800. And again, that's only in network. And then out-of-pocket maximums will work the same way as we discussed for POS Explorer. So $5,000 per member and $10,000 per family with all of the co-payments, prescription drugs, deductibles, no co-insurance, sorry, all going towards that out-of-pocket maximum. So what if you're on this call and you're thinking, I have a dependent who lives, outside of the service area. So for quality HMO, they live on the Cape, or for POS Explorer, you've got a dependent who lives outside of New England, going to college, or just lives outside the service area, because obviously you can cover your dependents up until they turn 26 now. You can still choose either of these plans and they would be covered. The coverage for out-of-area dependents is going to be better for POS Explorer because they have access to the United Healthcare Network, and they can essentially treat the plan like a PPO outside of the service area, so outside of New England. If they wanted to just get routine care, they could do that. For quality HMO, the coverage outside of the service area, so outside of Massachusetts, is going to be a little bit limited. So they can still get care if they need it. But if you have a dependent who is dealing with some health issues, if they've got chronic illness, if they're going to need to see someone, especially if they're in college over the course of the year, it would only be under certain circumstances, and anything routine, so like elective surgeries or procedures, those would not be covered. So they would need to take care of that when they're home, school vacations, breaks, summer break, so on and so forth. So just something to note. Quality HMO, here are the participating hospitals. Basically, your tier 1 hospitals and tier 2 hospitals are going to be the same as you saw for POS Explorer. And then any hospital that falls into tier 3 for POS Explorer is going to be excluded from the quality HMO network. There is one exception to this, and that is Berkshire Medical Center. So Berkshire Medical Center is tier 3 for POS Explorer, but the GIC did make the decision to include Berkshire Medical Center at the tier 2 level of benefits for quality HMO. I think you folks know, you live out that way. It can be, the hospitals can be a little few and far between. We do have coverage, but that could mean that the closest hospital to you is still an hour away. So in an effort just to make things a little bit easier, Berkshire Medical Center is included out your way for quality HMO. Access America. So Access America is the third commercial plan that we offer. For this plan, enrollees need to live in the United States, but outside of New England. So you live in New York, you live in Florida, you live in California, you live outside of New England. So with this plan, your in-network coverage, if you are outside of New England, is through United Healthcare's network. They essentially lease their network to us, so we again can provide that nationwide coverage. If you are in New England, you're on vacation, you're visiting family, what have you, you have the option of seeing providers that are part of Harvard Pilgrim's network. So essentially, you are covered all over the country. You do have the option of going out of network. You have out of network coverage in the event you are seeing a provider who is not part of United Healthcare or Harvard Pilgrim. And this plan isn't tiered. So no tiering. Your PCP and specialist co-payments are $20 and $45. There's no variation there. You don't need to choose a PCP for this plan. There's no referrals. We would always encourage folks to choose a PCP. It's good to have. This plan does have an in-network and out-of-network deductible. Like POS Explorer, it's $500 for individuals and $1,000 for family. And then the out-of-pocket maximums for this plan are the same as what we saw for POS Explorer and quality HMO. So it's 5,000 and 10,000. And I just lost my presentation. Oh my goodness. Oh, we're back. Okay. So discounts and savings. You have access to a whole host of discounts and savings. So there is a fitness reimbursement. We reimburse $100 per calendar year for individual plans. And then if you're on a family plan, you can get up to $200. There are discounts for eyewear. We offer complementary and alternative medicine. So there are discounts there as well for members who are expecting or who may plan to be expecting. You have a child care education class reimbursement. And then there are some other discounts for hearing aids, healthy eating, lifestyle management. I included the QR codes here on the screen, and I am going to send this presentation out to Claire afterwards. So hopefully she can put it somewhere where you'll be able to access it. But all of this information is also available online. Portal access. So if you are a member of Harvard Pilgrim, you have access to our member portal. The member portal is a really, really great tool. It's really easy to register. And then with the portal, you have access to your claim information. If you paid money out of pocket, you can see how much money you've accumulated towards your deductible, how much you've accumulated towards your out-of-pocket maximum. If you misplace your ID card, you can order a new ID card. You can send a secure email to member services. And this is a really great feature because for members of the GIC, the emails are prioritized. So you send an email and it basically goes right to the top of the list. And the goal in member services is to answer GIC member emails within 24 hours or 1 business day. So if you don't want to call into the queue, although the wait time is typically not very long, but you're going about your day, you're doing your stuff, you just want to send a quick email, you have that option. You also, of course, have the option to call us. Member Services does have a dedicated line for GIC members, and the folks answering the phones have been trained on the GIC plans and can answer your questions about providers and claims and benefits, really anything you would want to ask. So again, here we just talk about the dedicated member services line. The hours of operation that the call centers are open are right there in front of you on the screen. In the middle, you see pharmacy coverage. So pharmacy benefits are administered by CVS Caremark. The GIC does carve these out from the medical benefits across the board. So every carrier who is going to present to you, presented yesterday, presented today, it's the same across the board. So CVS does have a dedicated line as well, and they also have a dedicated microsite for GIC members. So you can call and ask questions, you can go online and ask questions. We also have a dedicated microsite for GIC members. This microsite is going to have, my gosh, so much stuff. It has all of your plan documents. It's got a member guide that is just chock full of information. It has the provider directories. So if you go to the microsite, you can see the different products. So you'll see Explorer POS and there's a drop down and it has the plan documents, but it has the provider directory for that product. So you can go in, you can look up your providers, you can find out what tier they're in. This is especially important if you are considering choosing the quality HMO plan. So I cannot stress how critical it is to go online, access that quality HMO provider directory and see, make sure that your providers are participating. If anyone struggles with the provider directories, we have resources that can help that I'll get to in just a second. So we're going to get into Medicare. Let me see if I can find Cheryl. She might be stuck in the
No, I made it.
You're here.
Yes.
Hooray. Okay. So I'm going to turn over to my colleague Cheryl Begnell, who is going to take folks through the different options for retirees.
Thank you, Andrea. Good afternoon. My name is Cheryl Begnell, and I handle the 2 retiree plans that Point 32 Health offers. The first one is the Harvard Pilgrim Medicare
Cheryl.
Enhanced. This is a
Cheryl.
Medicare supplement.
Bad. Your audio's not great.
Okay. Okay. How's that? Any better?
How about now?
Okay. Let me testing. Any clearer?
I don't know. No. You want me to go through this part?
Sure. If they can't hear me, if the connection's bad.
It's choppy.
Yeah, I have no idea why.
All right, you know what? I can present these two and then maybe just keep an eye on the chat and you can jump into the chat for that. So,
Absolutely.
all right.
Thank
All
you.
right. Sorry to steal your thunder. All right. Well, I'm back. Technical difficulties. Thanks for bearing with us. I'm going to try to do my best. Cheryl really is the expert here. Okay, so we offer two plans for retirees. The first is Harvard Pilgrim Medicare Enhance. This is a plan that is available across the entire United States. You need to live in the US, and it's a supplement plan. So with a Medicare Enhance plan, Medicare is going to be your primary coverage, and then the Medicare Enhance portion is going to kick in and sort of pay the balance. For this plan, no PCP. There isn't a network. So if you went to the microsite, you are not going to find a Harvard Pilgrim Medicare Enhanced directory. And that's because for this plan, you can see any provider who accepts Medicare. This plan has enhanced coverage. It has routine vision, hearing aids, wellness benefits. So it's got some of the things that are not typically covered by Medicare. You can see in front of you, we did a snapshot of some of the most utilized benefits. So you can see that for inpatient hospitalization, you have no copay. Skilled nursing, there's no copay. Really, the only things you're going to pay copays for is office visit, and that's if you're having an office visit that is not, I believe, non-preventive. And then routine physicals, there you go, zero. If you go down to urgent care, it's $15 for urgent care, $50 copay for the emergency room, and then behavioral health, substance use disorder, $15 copay. And then for routine eye exams, also $15, and you get a discount on lenses, frames, contacts, and you get one routine eye exam every 24 months. The second plan that we offer to retirees is Tufts Health Plan Medicare Preferred. This also can be referred to as a Medicare Advantage plan. So this plan is available to enrollees in most of Massachusetts. But if you are in Berkshire County, which is, I think, probably quite a few of you, Nantucket, Dukes, and Franklin, you are not eligible for this product. Medicare Preferred, Medicare Advantage plans, they replace Medicare. So essentially, Medicare steps out and the Advantage plan is your coverage. This works very much like an HMO. So you need to choose a PCP, you need to get referrals, and there is a network. So there's a Tufts Medicare Preferred network, and those would be the providers that you see. Very much like the Medicare Enhanced plan, there's enhanced coverage for routine vision, hearing aids, and wellness. And if you look at right in front of you, you see that the copays are low as well. So you're going to pay $15 to see your PCP, zero for your annual wellness visit, and then copays really across the board are $15, with the exception of outpatient services, which take a $0 copay. In the emergency room, which is $50. So if you go to the ER and you happen to be admitted, the copay for the emergency room is waived. So Medicare Preferred, this is the only Medicare plan that's offered to GI, the only Medicare Advantage plan, excuse me, that's offered to GIC retirees. Medicare Enhance, you do have some discounts and savings. So fitness reimbursement, you get $100 every calendar year. You have discounts on eyewear. As we saw with the commercial plans, you've got some discounts for acupuncture, Tai Chi, mindfulness, so that complementary alternative medicine. There are some fitness discounts that you see here. And then you do get additional discounts for hearing aids, healthy eating, lifestyle management, and smoking cessation, nutrition. So there's a whole host of them. And again, so plug for the microsite, go there, lots of information. There are discounts as well for the Medicare preferred plan. So there's an eyewear benefit. You get $150 every calendar year towards eyewear at an iMed vision care provider. Or if you wanted to go to someone outside of iMed, you would get $90 per year. You get a wellness allowance, which is $150 per year, calendar year. And this is going to be for if you go to a fitness club, if you take classes, if you are signed up for virtual classes. A lot of folks these days have Pelotons, so virtual would be covered as well. It also goes towards nutritional counseling, acupuncture. So you can use that $150 for a lot of stuff. Hearing aids for members 22 and over, the first 500 is covered in full, and then you pay 20% of the next 1,500, which basically gets you to a benefit of $1,700 per member every 24 months. And then last but definitely not least, you get $150 per calendar year toward program fee for Weight Watchers, and then that would also include hospital-based weight loss programs you would be eligible for. Member support. So Medicare Enhance is going to be the same phone number that you call for POS Explorer, Quality HMO, and Access America. So that does go to our commercial call center. That is a dedicated line. And then Medicare Preferred, that is also a dedicated line. So folks are trained and ready to answer questions. Pharmacy coverage, again, for the Medicare plans, it continues to be carved out. It's through SilverScript, which is part of CVS Caremark. They're affiliated with them, and they administer the GIC drug benefits. So they do have, again, that dedicated line. They have a dedicated microsite. They're there to answer questions. And then again, here you see on the right hand side of the screen, your dedicated microsite for Medicare Enhance, and then there's also a dedicated microsite for Medicare Preferred. So as you'll see, Medicare Enhance is administered by Harvard Pilgrim. Medicare Preferred is through Tufts Health Plan, and both those companies are now part of Point 32 Health, which is the combination of Harvard Pilgrim and Tufts Health Plan. And both of those companies have been serving the GIC at this point for more than 40 years. So finally, just this last slide, if you don't know which plan might be right for you, you like, should I pick, do I want Quality HMO? Do I want Explorer POS? What should I do? We have a team, it's called Smart Start, and the number is right here on the screen, and you can call the Smart Start number, and they can sort of help talk you through those choices and what plan might be best for you. They can only help you choose which Harvard Pilgrim plan might be best for you. Unfortunately, they're not able to offer information on how our plans might compare to our competitors. But if you are struggling in trying to choose between two Harvard Pilgrim plans, they can certainly help you make that decision. And then if you had questions about Medicare Preferred HMO, you can call our inside sales team and they can help you with those questions as well. So that is my presentation. I can leave it up and go back to any slides that folks might have questions on. I know that we've got I know that the chat is seems like it's happening. People have got some good questions. It looks like we feel like we're caught up.
There's a couple.
Ooh.
It's not good.
I'm gonna try my computer. Okay, let's try this one.
Ooh, I think that sounds better.
Okay.
We actually have a question that was asked in advance for someone who couldn't attend, and their question was that Cooley Dickinson looks like it is out of network. So does that mean that you cannot go there, or can you go there if you get a referral?
That's a hospital in Northampton.
Cooley Dickinson is out of network for, hold on, is out of network for, it's out of network for Quality HMO. So Cooley Dickinson is in network for Explorer POS, but not for Quality HMO. So if you are a member who chooses Quality HMO, you cannot go to Cooley Dickinson, even with a referral.
Thank you. The next question is, what type of coverage and copay for Tully walk-in?
I don't know what that is.
Tully is a provider facility in North Athol, or
It's an urgent care, isn't it?
is it an urgent
I
care?
believe so.
But the zip code would be 01331.
So it looks like it looks like it's part of Haywood. Is that right?
I think that is right. Yes.
All right.
So Haywood Hospital's in tier 1 list.
Yeah, Haywood is in tier 1. It really depends on how they bill the claim. So it looks like it's a walk-in center, but it depends on if they've contracted with us that way. Lynn, can you root around in the provider directory and see what comes up? Sometimes what happens with urgent care centers that are part of hospitals is they don't, even though they look, smell, taste, feel like an urgent care center, they're actually an offshoot of the outpatient, and they bill claims like they're outpatient claims, and so it takes that tiered copay instead of an urgent care copay. So urgent care copays under these plans, the commercial plans, are they're $20, and that includes hospital urgent care centers. So ideally, Tully has contracted with us in such a way that they are just considered hospital-based urgent care, and it takes that lower $20 copayment. I realize that this is an answer that's kind of a non-answer, but it really it depends on how they've contracted with the plans. And I'm gonna make a note in the event Lynn can't find them in the directory.
So would the member get that answer by just calling the facility and asking the question?
No, I would love to say yes, I really would. But I find that sometimes the facilities themselves, especially when it comes to hospital-based urgent care, they're not always 100% sure of how they're set up in the different systems. So we will take that back and find out for sure, and we can follow up via email with you folks after the meeting.
I actually found it.
Oh, you did? Oh, yay!
I found Tully Walk-in Care Center that's in Athol, Mass. That's the urgent care. It is a tier 1, so it will bill underneath the urgent care.
So we'll take that lower
And
$20.
yep. So if I searched on the Quality HMO directory, which means it's the tier 1 for Explorer POS as well.
Perfect. Awesome. Thank you.
You're welcome.
Next question is, my provider indicates they accept Harvard Pilgrim Elevate plan options only. What is an Elevate plan?
That is a good question. I did see that in the chat before we started, and I probably shouldn't admit this, but I had to Google, and it looks like that is a plan that is offered to folks in New Hampshire, but it looks like it's just a network. So the Elevate Health Network includes 21 high quality hospitals. I would, the person who asked that question, would you be willing to share your provider's name in the chat, and we can have Lynn pull them up in the directory real quick and see?
While we're waiting on that, I'm going to go to the next question. Are there hospitals and providers that are only HMO and not included with the POS plan?
There are not. So the reverse is true. There are providers and hospitals that would only be with the POS plan, that would only be, sorry, with the HMO plan. But if there is a provider who is in the Harvard Pilgrim Network, they are in the POS plan always, and there is the potential that they could be excluded from the HMO, the quality plan, especially if they're part of Mass General Brigham, those facilities that fall into tier 3 under Explorer POS.
Does anyone in the room have any questions?
I have a question regarding health in New England.
That's coming up shortly then.
Okay.
Elevate Plans is from Brattleboro Primary Care in Brattleboro, Vermont.
See, Lynn is furiously searching in the provider directory. While Lynn continues searching, other questions? Looks like there's a little bit of a smaller group today than there was yesterday.
44. So I have tried to follow the hearing aid benefits available throughout the plans. Are they generally the same with the 3 different Harvard Pilgrim plans?
For the commercial plans, yes. For the Medicare plans, Cheryl, can you put it in the chat if your audio is still funky? Someone asked, do we have a slide showing participating hospitals for Medicare Enhance? So we don't. The reason for that is because Medicare Enhance doesn't have a network. For Medicare Enhance, you can see any provider, any hospital that accepts Medicare. That's how it works. Does the preferred Medicare Franklin County exclusion apply if the provider is in Worcester County? So that the exclusion, the eligibility exclusion is based on where you live. It's not based on where the provider is. So if you are living in Franklin County, you are not eligible for the Tufts Medicare Preferred Plan. It's outside of the eligibility area. For all of the plans, eligibility, so the geographical rules are always based on where you as the subscriber live, and that is determined by the address that you have on file with the GIC. So for example, you live in Massachusetts most of the year, but you travel to Florida for a few months. You know, which plan do you pick? The POS Explorer? Do you choose do you choose Access America? It depends. So what is it? Where do you really live? What do you have listed as your official residence with the GIC? If you're in Florida 9 months of the year, probably would make sense for you to list Florida as your primary residence and to choose the Access America plan. If you're in Massachusetts, New England, for most of the year, you have a Massachusetts address on file, a New England address on file. You would want to choose POS Explorer. And then if you're just in Massachusetts, but not on the Cape, which I'm thinking none of you live on the Cape, then you could consider Quality HMO, but again, only after you confirm that your providers are participating in that product.
Anything new come in there, Linda? No other questions. Any other questions from the room here? Okay. It is pretty close to 4:15, and we appreciate your time coming out to join us. And
absolutely, happy to. I will send. I'll send the presentation out. I'll send it, Claire, to you, and it has, all the links. It's got those QR codes. Again, just plug for people to go out and spend some time on the GIC microsite through Harvard Pilgrim. It really does have a lot of good information. Spend some time in the provider directories, look for your providers, see what tier they're in. And then, I think take all of the information that you've heard over the last 2 days, which I know is a lot. I think it's a lot to take in and digest for sure. But you've got a good amount of time to make your decision. Just please make sure that you do it by May 1st. If you miss the open enrollment deadline, it's it's not good. So just bear that in mind as you are going through and making your choices. Now I see that Glenda from Health New England is here, and I think that that she's up next. I'm going to drop. We're going to drop to get to another meeting, but questions, comments, concerns, happy to take those via email if you want to share them with Claire after the fact.
Great. That's great. Thanks so much for joining
Thank
us.
you so much. Bye, everyone.
Have a great afternoon.
You too.